All right, Shalom. I want to give all the praise, honor, and glory to Yahweh Bahasham, Yahweh Shai Bahasham Rakak Kwadash. Double honors to the apostles and elders of Great Millstone who taught me this truth, and Shalom to the hopeful elect. Behold, the plagues draw nigh and are not slack. Jeremiah 28:8. And it reads, it says, the prophets that have been before me and before thee of old prophesy both against many countries and against great kingdoms of war and of evil and of pestilence. All right, NLT. The ancient prophets who preceded you and me spoke against many nations, always warning of war, disaster, and disease.
The outbreaks of Ebola and hantavirus in the past 2 weeks show why international threats need an international response. They show why the world needs the international health regulations and why it needs WHO.
Our Chief Africa correspondent Jennifer Zabazaja joins us from Johannesburg. So just walk us through the latest. What is happening on the ground, Jen?
Yeah, Jumana, what we know right now is that there are more confirmed suspected cases and also deaths right now. Just about 500 suspected cases and just over 131 deaths linked to this Ebola strain in the DRC. What we just heard there from Director General Tedros just speaks to some of the concern for health agencies with this new strain just because it's so understudied. What we did learn on Tuesday, though, is that the CDC is working to move more people who are classified as higher risk to Germany, and potentially Czech Republic is also going to be added to one of those countries that will host some of these individuals. But again, what's really complicated health authorities is that this Bundibugyo strain is quite different from some of the other Ebola strains we've seen in the past years. Some of the symptoms early on sort of mimic what we've seen with malaria and flu, potentially why many of these cases could have gone underreported or unsuspected for so many weeks.
Yeah, and how are we seeing the international community respond, particularly from a financial perspective?
Yeah, what was interesting to hear from the Director General there is that he is calling for international coordinated response. We're seeing that really coming together and mobilizing, especially from the U.S., which I should point out, the U.S. did leave the WHO in early 2026. But on Tuesday, we did hear that the U.S. announced a funding commitment to accelerate, among other things, frontline care. They say that this will help fund up to 50 treatment clinics in the DRC and Uganda. And the U.S. reiterating that this shows their commitment to global health and humanitarian partners. Again, the U.S. did leave the WHO in 2026, but we did hear the WHO also saying that they are working to mobilize about $3.4 million from their emergency contingency fund. Africa's CDC also working to mobilize more funds, but quite critical to all of this is what we heard from Director General Tedros, and he's saying that this is showing just the financial strain that not just the organization is under, but really the financial pressures that a lot of health agencies are facing, given that over the past few years we have seen a declining of aid. So potentially this will affect the ultimate response, but we are seeing a bit of mobilization as far as this current outbreak is concerned.
Right, and you see they had Jake in the forefront of it all, right? But I want to make a point real quick, all right? Because this is the man of mischief, right? Let's go to Proverbs 4:16. All right, this is Proverbs chapter 4, verse 16, and it reads, it says, for they sleep not, except they have done mischief, and their sleep is taken away unless they cause some to fall. Verse 17, for they eat the bread of wickedness and drink the wine of violence. Now, what I'm going to show you in this next video is that, people are starting to catch on. People are seeing that, it's another setup. All right, because this devil, he's never satisfied. Right. Let me add on to that as well. Okay, they're not going to stop. Right. This is Proverbs 27 and verse 20 says, hell and destruction are never full, So the eyes of men are never satisfied, right? So this devil, he's never satisfied, man. He's the man of violence. He's the man of wickedness. All right. Mischief is in all his ways. All right. And they're going to do this shit all over again, as we've been warning you about. Let me pull this up as well. Right. So check this out. This is from the epochtimes.com. And the headline reads, it says, New York governor signs bills to preserve mandatory vaccines. Okay, we warned you. It's the same play, right? It says New York has in the past only mandated vaccines approved and recommended by federal health agencies, all right? So it's the same play. Okay, we've seen this before, right? Let's summarize it real quick. Okay, so it says here, a summary of New York vaccine legislation on May 15th. New York Governor Kathy Hochul signed 2 bills into law. Right? How's it going, Isaiah? The 10th chapter, they subscribe those unlawful decrees. You know, it says signed 2 bills into law that decouple the state's vaccine mandates and insurance requirements from federal guidelines. This action follows shift in federal recommendations under the Trump administration, right? Key provisions of the legislation. Assembly Bill 10711 removes the requirement for state-mandated childhood vaccines to have federal approval. Instead, children must be vaccinated against diseases like measles and hepatitis B in accordance with regulations issued directly by the New York State Health Commissioner. All right, so they don't need to go to the federal health agencies, as we're reading, right? You know, they can make the mandates, right? And they can do this in any state if they want to, right? It says Assembly Bill 10710 mandates that health insurers in New York cover vaccines recommended by the state's health commissioner, regardless of whether they are recommended by the Federal Centers for Disease Control and Prevention, CDC. So yeah, so now they got the power. The state got the power, okay, to issue these mandatory, jabs. You see? Let's see what else we got. It says context and perspectives, state leadership stance. Governor Hochul and state health officials stated that the measures protect public health and defend evidence-based medical guidance against, quote, anti-science shifts and misinformation at the federal level, right? Federal context, the Trump administration previously narrowed U.S. vaccine recommendations for diseases such as C-19, hepatitis B, and rotavirus, while a federal judge blocked these changes due to procedural issues. The administration has appealed. All right, there you go. So I want to show you here because she made that point about the this woman makes the point about the misinformation and how people, are speaking about these things. Let me just play that real quick too. Right. Here's some more news 3 hours ago. CBS News. Latest news on Ebola outbreak as experts warn about misinformation online. See that? So like I was saying, people are talking about it. They're catching on. They're seeing that this thing is getting ready to happen again. All right. Another demic, more lockdowns. Okay. Basically 2020 all over again, right?
Welcome back. The U.S. State Department has activated a dedicated Ebola response task force. The department says it's coordinating with U.S.-aligned companies operating in the Eastern Democratic Republic of the Congo to monitor and respond to the outbreak there. The U.S. is assisting with health screenings at borders and points of entry and has shipped emergency personnel protection equipment. The head of the World Health Organization, meanwhile, says the risk of the Ebola outbreak spreading is low globally, but the risk in the DRC and in Uganda remains high.
CBS News medical correspondent Dr. Celine Gounder joins us now. She's also editor-at-large for public health at KFF Health News. And so importantly, you were there in West Africa during the 2014 Ebola outbreak that lasted 2 years. Dr. Gounder, what do we know about the Americans who've been impacted?
So Dr. Peter Stafford, the surgeon who worked for the organization, Christian missionary organization, Serge, has been evacuated to Charité. It's a hospital in Germany that specializes in patients with special pathogens. So, for example, Ebola. His wife, Dr. Rebecca Stafford, and their 4 children have also been evacuated to Germany for quarantine and to see if they develop any symptoms of Ebola. There's a third doctor, Dr. Patrick La Rochelle, who has been evacuated to the Czech Republic. He is considered a high-risk contact like the others, the wife and the children. I do want to point out that in 2014, the Americans who had these high-risk exposures and or who had Ebola were medevac to the United States. That did not happen this time. They were sent to Emory and the University of Nebraska Medical Center. At that time, President Trump was not president, but he had tweeted in all caps, "Keep them out of here," and had called for President Obama to resign over the fact that he was bringing them back here.
So in 2014, Americans with Ebola were brought back to the U.S., treated here in American hospitals, and in this case, they're in Europe.
Correct.
Which really just underscores the difference in policy and approach by this administration compared to previous. There's also, in this day and age, much more misinformation and disinformation at our viewers' fingertips. What have you seen that appears to be the most damaging?
Well, this is something I have seen. I've worked in so many different epidemics going back to HIV/AIDS in the late 90s in South Africa, where people were saying it's a hoax. And we see the same playbook over and over and over again. So over the weekend, I used
just like the people, man. All right, it's the same playbook over and over again. All right, these different psyops, biological warfare on the people. All right, so people are speaking up about it. All right, they're calling it out.
some social listening tools just to see what was starting to emerge. So
what are social listening tools? What are social listening tools?
There are different kinds of tech tools online that you can use to analyze what's coming out on different kinds of social media platforms.
Phrases and trends and themes.
Yeah, all kinds of things. And so we first heard about Ebola in the DRC on Friday. I forget if it was Sunday morning that I started looking at this. And at that point, there were over 600 videos on TikTok, YouTube, and Instagram that had already garnered over 68 million views. And they were supplement sellers.
Wow.
You had conspiracy theory accounts calling Ebola a bioweapon or a hoax.
There you go. See, they're talking about this on the mainstream news. All right. People are, like I said, people are peeping game. Okay. A bio attack, psyop, biological warfare. All right. People see it, man. And remember, scripture say we're not ignorant of Satan's devices, man. So now you understand why social media is such a problem for these devils, man. This is why they want to control the narrative, right? This is why they're as I went to the lesson the other day, they're implementing the AI, right? Let me pull that back up. Okay, so they got the AI that can judge information that's being put out online. All right, this is from TechCrunch.com. Again, it says, "Can AI judge journalism?" A Till-backed startup says yes, even if it risks chilling whistleblowers. Right, as I brought out the example. Okay, here it is right here. You know. They got the AI set up, the green truth-telling corrections and engagement, the red one ignoring objections and spreading false claims. So, and they rated the journalists, I guess what she put out there or whatnot. So this is where it's at. Okay, let me see if we can get something from out the summary real quick. Okay, this is why they're concerned about the misinformation online and what people are talking about, man, because their narratives are not working. All right, people are waking up to the bullshit, man. Let's see. Here we go. Overview of objection. Right here it says the technology says the platform relies on a jury, quote unquote, of large language models from OpenAI, Anthropic, XAI, Mistral, and Google to evaluate claims. It applies scientific rigor and cryptographic systems to grade evidence on an honor index. You see that? So the AI, they got the AI to judge what people are putting out online, whether you can trust the source or not, whether it's a valid take, a valid article. You see? So this is what we coming into, man, right? So let's go back.
Videos on TikTok, YouTube, and Instagram that had already garnered over 68 million views, and they were supplement sellers.
Wow.
You had conspiracy theory accounts calling Ebola a bioweapon or a hoax. You had a tweet with photos of healthcare workers in biohazard suits. This tweet calls this a movie set, and it was actually a photo of people transporting the cruise ship passengers where there was the hantavirus outbreak. This was not a photo even of what was happening in the DRC or Uganda. So you see this same playbook over and over and over again with COVID. We saw it with Mpox, we saw it with bird flu, we've seen it with hantavirus, and now with Ebola.
Yeah, it's the same playbook with you devils, right? Like I said, this is the man of mischief, right? And people are peeping that, right? Proverbs 36 and 3. I'm sorry, not Proverbs 36, Psalms 36, right? Psalms 36 and 3, and it reads, the words of his mouth are iniquity and deceit. All right, people don't believe you, man. They don't trust you. The words of his mouth are iniquity and deceit. He have left off to be wise and to do good. Verse 4, he deviseth mischief upon his bed. He setteth himself in a way that is not good. He abhorreth not evil. Okay? NLT, they lie awake at night, hatching sinful plots. Their actions are never good. They make no attempt to turn from evil. So yeah, so people can't trust you. They don't believe your words, right? So again, this is what she's addressing on this panel here, right? How, these different so-called conspiracies and, what they label misinformation, how it's, spreading online. Millions of people are watching it, checking it out. See?
And a recent study showed that the 96% of the top health misinfo influencers, so spreading misinformation.
Yeah, see? The what is the real danger, you see? Because you got to understand, from the time of the C-19 to this point now, all the information that has been brought out from alternative media, you got these whistleblowers, these doctors that have been speaking out about the the health consequences behind the people who took it, the heart attacks and the different diseases, different health problems people are having, the turbo cancers, right? So all of this shit has been spread all over the world, man. So people know what's up. All right, so they're gonna have a hard time of trying to get people to buy into this again. This is why through the Spirit, they're gonna have to bring something, major, man. Something major is gonna happen sooner or later.
Have financial interest in what they're selling. Supplements, could be courses, paid memberships. And look, outbreaks make for very...
Check that out. Conspiracy theorists blame the you-know-what. So they're hurt.
very profitable content.
Because people are scared,
People
right?
are scared and they leverage the fear. They leverage
Be
anger.
careful.
So what's your advice to people to be able to tell the truth versus what's not right?
So first, look at who is benefiting from this. Are they selling supplements? Are they asking you to follow or subscribe their account? And by the way, this is how influencers make a living, right? They build an
That's
audience,
true.
they sell the audience for advertising. And so this is basically marketing. It's not public health information. Secondly, look at the timing. So are they advertising a treatment just hours after the outbreak is announced? I got an email from somebody telling me baking soda was the solution to Ebola.
They emailed the wrong person.
Yeah, they're talking to the wrong person. But look, when you're talking about a Bundabujo Ebola virus, for which there is no approved treatment or vaccine, and then you're telling me that you have the miracle cure, that is very suspicious. And thirdly, the tone. So
Yeah.
people who are giving reliable information are not putting things in all caps. They're not leveraging fear and anger.
Creating hype.
Exactly. They're calm.
Like you,
They're
Dr.
calm.
Gounder. Thank you so much.
Thank you, Dr. Gounder.
Yeah. So these The devils are watching everything, man. So again, like we said, they're going to do it all over again. All right? Real quick. 2 Ezra 15 and verse 10. And it reads, it says, behold, my people is led as a flock to the slaughter. I will not suffer them now to dwell in the land of Egypt. Verse 11. But I will bring them with the mighty hand and the stretched out arm and smite Egypt with plagues as before. Okay? And will destroy all the land thereof, right? So we're in the midst of spiritual Egypt. And the Lord is going to smite Egypt with plagues as before. And this is where we at now. Egypt shall mourn, and the foundation of it shall be smitten with the plague and punishment that the Most High shall bring upon it, right? So the plagues are here. They that till the ground shall mourn, for their seed shall fail through the blasting and hail, and with a fearful constellation, right? Going into, the famines and stuff, right? Let me pull that up as well, because that's part of the plagues too, right? This came out today, political.com. It says the world has 6 months to avert major food crisis, says UN as Hormuz struggle drags on. All right, so they're saying 6 months left until a major food crisis, man. It says the closure of the Strait of Hormuz is not a temporary disruption, but the start of a systematic shock to global food prices, the UN Food Agency said Wednesday, right? Let's see what we can get from this too. See? The plagues draw nigh and are not slack. Right? Food crisis and price increases, rising prices driven by high energy costs and Middle East conflict disruptions. The FAO Food Price Index increased for a third consecutive month in April. The crisis pipeline, the FAO projects the shock will ripple through 6 sequential stages: high energy costs, fertilizer shortages, seed scarcity, reduced crop yields, surging commodity prices, food inflation for consumers. There you go. Global impact and vulnerabilities. Vulnerable regions, poorer countries in Asia, Africa, and Latin America face the highest risk due to their heavy reliance on nitrogen fertilizer imported from the Middle East. Right? Yeah, there you go. Straight to the point, man. Plagues, right? 2 Ezra 16:37, and it reads, it says, behold, the plagues draw nigh and are not slack. All right? These plagues are not slacking, man. Everything is coming in full speed, man. They're talking about 6 months left for a major food crisis, man. Hey, this is no joke. Okay? It says, as when a woman with a child in the 9th month bringeth forth her son, with 2 or 3 hours of her birth, great pains can pass her womb, which pains when the child cometh forth, they slack not a moment. See? Even so shall not the plagues be slack to come upon the earth, and the world shall mourn, and sorrow shall come upon it on every side, man. Hey, this shit is about to get bad. We're trying to warn you, man. Right? You got food crisis, the Strait of Hormuz, supply chain shortages. You got these different plagues, diseases that are being set up. Okay, mandatory jabs. Come on, man. Right? Let's get this last one too. Just to make the point, finish it out here. It says, this is from newstarget.com. It says, it's critical to prepare now for the coming collapse, as we've been warning you about, man. Right? The coming collapse. All right? Sorrow should come upon the world on every side, man. Right? It says the impending systematic collapse, signs of collapse. The author asserts that modern civilization is nearing collapse due to a rigged, debt-fueled economic system, an intentionally diminished education system, a corrupted legal structure, and rigged elections designed to install specific loyalists. Global threats. Global entities are allegedly engineering supply chain disruptions, see? Such as fertilizer shutdowns and tensions in the Strait of Hormuz for depopulation while utilizing C-19 as a bioweapon and transitioning toward a AI system meant to replace human labor, right? All these things are true, right? It says the rise of AI superintelligence, data center expansion, all right? 3D world simulators, okay? And the rest reads on, right? So all hell is about to break loose, man. Okay? The writing's on the wall, right? And that's pretty much it. You know, we'll end it with this. Back in the 2nd Ezra 15 at the top. Okay? 2nd Ezra 15 and 5. Behold, saith the Lord, Yahweh Shemel Shai, will bring plagues upon the world. The sword, famine, death, and destruction. For wickedness has exceedingly polluted the whole earth, and their hurtful works are fulfilled. So it's about to go down, man. Okay? We are at that point. You see? Shalom to the next one. Shalom.